Hi, amazing people. Welcome once more to our amazing channel and slot. Safe pregnancy, safe delivery. Here you have to Nzometia, and of course, our objective is to ensure that we have a good mother, good baby. And the person anchoring this amazing slot is no other but our favorite gynecologist and obstetrician, Dr. Nzometia Crysantus. Today we are coming here with another amazing session for you. If you've not joined the family by subscribing, you may want to do that immediately. So that whenever we share any of these amazing videos, you'll be the first to see and you will enjoy it.
Hi guys, thank you so much. Thank you so much for connecting once more. As we promised you, Wednesdays at least once a week or every 2 weeks, we share a video on pregnancy because our objective is to ensure that you come out healthy and your baby too is healthy. So today we are going to be talking about the danger signs to watch out for during pregnancy. Because pregnancy, as good as it is, sometimes there could be some dangers that will signal. And when these dangers come, if recognized and acted upon on time, it will be rectified. The situation will be rectified in most cases. Though some cases may be inevitable, but most cases will be resolved. And of course, your pregnancy will be saved and it will continue evolving, and at the end, you yourself. And it will interest you to know that some of these danger signs concerns both the mother and the baby. Now, these danger signs are also specific depending on the age of pregnancy, because pregnancy is divided into 3 trimesters. You have the first trimester of pregnancy that goes up to 3 months, the second trimester that goes up to 7 months, and the third trimester, which is the last 2 months of pregnancy. During the first trimester, there are several signs. One of the major things that happens during the first trimester of pregnancy are the pregnancy symptoms that you'll be feeling all the times. The morning sickness, the vomiting, the sleep, the tiredness, and the on and off fevers that will come but not severe. If those symptoms suddenly stop, you don't feel them anymore during those first 3 months, then it is a danger sign. You have to consult. During the first trimester also, if you start bleeding, you have to consult. Don't stay in the house, don't try to buy drugs in the quarter. Consult your healthcare provider or rush to a nearby hospital immediately so something could be done. It's not also a call for you to just rush to do an ultrasound yourself. You are not a doctor. Consult and the doctor will prescribe a specific ultrasound for that. If you start feeling pains, abdominal pains, especially those that localize in your lower abdomen, it is a sign that you need to consult immediately. And then sometimes you could be vomiting, and the vomiting could become very excessive. Excessive vomiting is a danger sign. Vomiting is a sign of pregnancy, but when it becomes excessive, it is a danger sign. You need to consult because it could be affecting your own health. Because sometimes women are pregnant, they vomit too much, sometimes they are carrying twins, which causes exaggerated symptoms, and we need to actually treat them properly to restore their health, which will further benefit the baby. So these are the signs that you must watch out for. By the time you get to second trimester of pregnancy, that starts from around 14 weeks of pregnancy to 28 weeks. That period is usually mostly the best period because during that time symptoms subside. Why do symptoms subside? Because the abdomen has also grown and the baby has started kicking. So instead of vomiting, I told you in one of the videos the 3 mistakes to avoid with the advent of symptoms. That when you are feeling symptoms, it means that your baby is alive. Your baby is saying, "Mommy, I'm here." By the time you get to second trimester, the baby will be kicking. The baby will be kicking and your abdomen will be growing. Suddenly, if you notice your abdomen is no longer growing, it's a danger sign. Again, if you notice that your baby is no longer kicking the way your baby was kicking, then it is a danger sign. You need to consult. You need to consult. It's very important. Don't stay in the house. Don't rush to do ultrasound. It's consult. And then during the second trimester still up to third trimester, third trimester starts from 28 weeks. Sometimes after 20 weeks, there are things that could start happening. If you notice that you have gained weight excessively, you have to consult. If you start having headache, severe headaches, you have to consult. If you have fever, you have to go to the hospital. Don't stay in the house. Don't try to manage it. If you have your paracetamol in the house, you can take, but you are not taking for the fever to stop and you stay in the house. It is for you to reduce the fever and consult. If you start having blurred vision, you are not able to see clearly again, it may be a signaling a problem that is occurring because of the pregnancy. You need to consult. If you start having sudden onset of an abdominal pain, you have to consult. I told you, especially pain that is localized in your pelvis. If you start having difficulties to breathe, even if you are an asthmatic, you need to go and consult. If you are not an asthmatic, you need to go and consult. If that doesn't happen, you may start having pain that is localized around the epigastrium, abdominal pain or epigastric pain. It is not always gastric. It could be signaling a problem, a sickness that is occurring because of the pregnancy. You have to consult immediately. If you start having generalized abdominal pain, you have to consult. Sometimes sudden onset of pain, you have to consult. Now, concern your baby. If the baby stops kicking, you have to consult immediately. That's the main thing that will tell you that this baby may be having a challenge. Those frequent kicks. Even if it reduced, you still have to consult. If it reduced, the baby that was kicking so frequently and suddenly reduced. Here the difference is only that towards third trimester, by the time you're around 36 weeks to upward, the kicks may reduce, but they will not stop. They may reduce, but they will not stop. The moment you notice that in 1 hour or 2 hours, you just have one kick or one or two only, it's a problem. You have to consult before they assure you that your baby is fine. The doctor will have to examine you, check you, and do some tests to ensure that everything is okay before letting you back home. These are very important signs to watch out for. Now, if that doesn't happen, you may start having bleeding. It may be mild bleeding, it may be profuse, it may be sudden. You have to consult because there are issues that may occur because of your pregnancy. Because of your pregnancy. If you notice that your body suddenly becomes so swollen, don't stay in the house. You have to consult. If your urine becomes like Coca-Cola, a clear color urine that turns Coca-Cola, you have to consult. That is surely a danger sign that needs a cross-examination before any other conclusion can be made. Thank you very much. We thought of sharing these things with you, so that you don't stay at home and sometimes you cry. But I want to congratulate many of our babies because most of the time they always contact me. They always contact us, and wherever you are doing your antenatal care all over the world, make sure you are close to your hospital. You have the contact of at least your midwife or your healthcare provider, and you have a means of transport so that in case of anything, day or night, you can easily get to them for any problem and it will be easily resolved. Thank you very much and God bless you. Don't forget to share this to help someone. We share it on our HSOM channel because we believe that even if you are not pregnant, you can take this knowledge and share with somebody else, because our objective is not only to rule out pregnancy complications that occur to both the mother and the baby, but to ensure that they come out healthy. Good mother,
Good baby.
Thank you.
Thank you very much, our favorite OBGYN. Can we give a shout out to him? We love you. I can hear you screaming. Oh my God. Thank you. Thank you, Dr. Nzometia, Crysantus. We are so grateful for your sacrifice of time, knowledge, energy, pouring into these amazing women, fathers, mothers, and fathers to be. We are so thankful. Thank you. God bless you. Bye. On to our next Lord. See you next week.